on, I think today's what, Wednesday, Tuesday?
Tuesday,
Tuesday.
March 18th.
So I'm going to call us out of recess. Our first topic for the day is we're going to have the Department of Health and Human Services give us a laydown on their overall structure for contracts. And then members who have questions on any specific contract or on any issue about contracts, this is your opportunity to ask them. I don't imagine a really huge presentation by the commissioner and Mr. White, because as I understand it, we have something like 900 contracts. What I asked them to do was to take a look at, say, the top 20 contracts that spend the most in general funds. And I figure if we look at the 20 most expensive general funds contracts, that would give us a decent proxy for understanding, what the department's doing and what the priorities are. And so with that, Madam Commissioner, Mr. White.
Good afternoon, members of the committee. Nathan White, Chief Financial Officer. And today before you, we've put together a presentation. The presentation is relatively short. There's a lot of information in there. And we've also included an appendix that you'll see that you'll have an opportunity to take a look at with the higher general fund contract and combination of contract dollars there. So if you start and we turn to page 2, so DHHS, our providers and our contractors really play a critical role in accomplishing Health and Human Services mission. And some of the contracts that we have are scenarios where the provider is providing direct services on behalf of the state to New Hampshire citizens. In other cases, the direct services are provided to the department. So examples are direct services to citizens or individuals within our community are the community mental health centers. That's a scenario where we have direct services being provided. Some of our area agencies. Scenarios where we have direct services provided to the department, that can come in the form of technical support relative to our software systems. It could be services that temporary agencies, staffing services at New Hampshire Hospital or Glencliff, just to try to give you sort of a broad picture of what that could look like. Now, you'll see on there on page 2, you'll see the agreement type and the count. And I pulled this count yesterday. And the purpose of this is to show you the many different types of agreements that we have. Contract, generally speaking, you could call any of these contracts, they're legally enforceable. But we have many different types of agreements that we use for different types of scenarios. So our service contracts, I know that some of you had conversations around like the standard terms and conditions of the P37. I think Representative Edward, we communicated on that. That's what you typically see for most contracts that go before GNC. We also have grant agreements. We've talked about the state loan repayment program when Tricia Tilley was here on public health. We have a lot of other miscellaneous contracts that may not actually have dollars in them, such as data sharing agreements, data use agreements. We have use of premises agreements that we use, and then we have memorandum of understanding, memorandum of agreements that we often have with other state agencies or governmental type organizations as well. And as you'll see there at the bottom, you'll see a total of 969 current agreements that are in effect today. That number is subject to change on any given week. That will go up, that will go down. Right now, we still have a number of contracts that are using ARPA funds and some other temporary federal funds that are set to expire in the coming years. So it's a little higher than pre-pandemic. The number there that you're looking at prior to that, we were probably in the range of 700 or 800. But again, that can go up or down depending on the work that's being done and the contracts and obligations that we have. If you turn to page 3, what we've done here is our contracts are budgeted, and you've probably picked up on this as we've gone through the details within many of the different accounting units in the different areas of the department. Our contracts are budgeted in a number of different places, and generally speaking, in many cases, they're budgeted in class 102, 103 for standard contracts, and then class 74 for our federally funded contracts. But there are a number of other areas, and there's a lot of history behind these unique class lines that you'll see there, the 562s, the 563s, the 643s. Those are class lines that were created over time, oftentimes at the request of the legislature or by the department intentionally to track certain expenditures. So it's not necessarily so easy that someone can run a report on all 102 and 103 and class 74 lines and get all the contracts that exist today. And then some of our contracts, to make this a little bit more complex, and Representative Seaworth and I were having this conversation just beforehand, we do also sometimes budget our contracts within multiple places in different accounting units and within different class lines. And that's intentional because that may be for the type of service and the type of funding that's directly tied to that. Because what we do with our contracts is you've heard us use the expression braid or mix funding, so that if we have general funds and we have different types of federal dollars, we try to braid those together in a single contract so that we don't have 7 different contracts with the same provider for services that are extremely similar, both from a public transparency, a tracking, logistically perspective. It makes a lot more sense to kind of mix those. That also makes, from a budgeting perspective, that does add a layer of complexity because you can't necessarily pull this thread without understanding the impacts over here. And in the chart in front of you there, if you just eyeball it really quick, you'll see that we've broken things down by general and total funds for each state fiscal year of the budget. And these are the dollars that are included in the governor's recommended budget in totality. And some areas you'll see, like Medicaid services, there's $174 million of general funds, but in total funds, it's over $1 billion, and that's because of the various federal matching that we're able to take advantage of. In other areas, there are block grants within DBH. We have block grants. We have block grants within DLTSS as well. The Division for Public Health Services, you'll see relatively small amount of general funds, but we do have a lot of smaller individual grants that support those. And with each one of those, as we've talked about before, sometimes there's a maintenance of effort requirement, sometimes there's matching funds, and then in some rare instances, we have both a matching requirement and a maintenance of effort requirement, just to make it a little bit more interesting. If you move to the next page, on page 4, this provides a high-level overview of our top contracts. And I'm going to hand this over to the commissioner. I'm just going to say a couple of really quick things. One, Representative Edwards, we ran out of space, so we only ended up with the top 18, not the top 20. Secondly, this represents groups of contracts in some cases and individual contracts in other cases. So the first item there, the MCOs, that's 3 contracts, versus the Medicaid Management Information System, that's a single contract, or community mental health centers, where that's 10 contracts. And we've done that intentionally because you don't necessarily just want to look at one single contract, because oftentimes when we go out to procure, we do this by regional coverage area, and you can't just say, oh, well, we're going to unfund Hillsborough, and then leave Coos County at 100%. And so that's why we have presented it in this way. And with that, I'll hand it over to the commissioner.
You took some of what I was going to say.
Oh.
Good afternoon. So at least you own that you had 18 instead of 20, and that's his.
I'm going to look at that as your first reduction. So you saved a sheet of paper for all of us, so thank you.
We might need a do-over then. So this list is purely looking at the highest general fund contracts. And as Nathan has explained, there's bunches of contracts. The way we've managed this deck and this presentation for you today is to be able to, at a high level, look at what those numbers are. And then at your inquiry, what would you like to know more about? Because I could have you here for 4 hours going through each line of them. I can do a caveat to say, though, that these contracts on this list serve, obviously, a very significant function in the department. They are contracts of how we provide services to our families, to our all of the folks in our state, our most vulnerable, right? So there are direct service contracts in here that Nathan has referenced, but there's also administrative infrastructure to do that. You can't just provide the service and not have an infrastructure to bill for it. You can't just provide the service and not have a way to measure effectiveness of the service, much less people served. So it's not, your job isn't easy. I'm going to acknowledge that up front, but any touch point on any of these is going to cause some harm for those we serve. And I would argue a little bit with Nathan on the MMIS, the Medicaid management. It actually is moving to more of a modular procurement, meaning that we don't have all of our eggs in one basket and we have the ability to update modules as needed rather than one monolithic system. Community mental health centers, that infrastructure there not only provides services, it meets litigation requirements. We have agreements. We have a lot of responsibilities that we have to meet, and we rely on our community mental health centers to help us carry that out. So I could go on and on and on. I could say the same thing about area agencies, many of these programs on here, but I thought it might be a better use of the time if you would direct us for where you have further inquiry.
I thank you for that invitation, that setup. I've been listening to members and people outside of the committee, and so I think I have a few questions to ask on the collective behalf. Number 8, area agencies. I've seen a list floated towards me. I don't have it in front of me, but it identified some potential ways to save money from area agencies by removing some of the obligations or duties that we were asking them to do contractually. That there would be an opportunity to relook the tasking to the area agencies to slim down what it is we're asking, and therefore maybe reduce the amount of money. Does this sound like a subject that you've heard discussed before? I mean, what can we say about area agencies and their contractual obligations to perform specific duties, and whether or not those duties could be restricted or reduced?
Sure. I'm going to have Chris Santinello come up and speak to when we look at what could potentially be reduced, causing the least amount of harm. That
Right.
would be what
Right. I
she would
think
be
they're
able to
both coming
focus
up.
on. Are you going to hang out over there?
Yeah.
Over here, is that okay? We're gonna be
It's
like
okay with
in
me.
the Muppets.
I don't know what you prefer. You.
It's
all
fine
right.
with me. I'm
All
flexible.
right.
Yeah, good afternoon. Melissa Hardy. I'm the Division Director for Long-Term Supports and Services. I've not seen a list that you've suggested that's been floated out there as far as reducing what's in the contract for area agencies. I do think it's pretty well spelled out in their contract what their duties are as a partner in our healthcare and developmental disability system. So it'd be, and not only for their own infrastructure, but for the family support services that they provide for individuals that are underinsured or have no insurance, no Medicaid. They truly play a vital role in our whole service delivery system for developmental services. So I haven't seen a list, so.
Neither.
Can you freelance? Are you confident that we've asked for exactly those duties that we need the area agencies to perform, and no more than what we really need?
Yes.
Like there's been some changes in their roles with billing, for example. And so I would assume that their reduced role in billing has been reflected, and I don't know if that saved us any money because we're asking them to do less.
So we've actually changed, Chris Santinello, Associate Commissioner. That is actually some of their duties is now outside of the contract, and that's the designated area agency rate, which is outside of this contract. I think, like when we have talked before,
Yeah.
much of the funding in this contract, so in 1989, the family support councils were established and actually funded by the legislature, and that is outlined in RSA 126G. And that actually designates funding for families to keep their sons or daughters at home and provide them the supports they need so their sons or daughters do not require institutionalization. That was part of the closing of Laconia State School. So within this contract, there's also funding for people who do not have Medicaid. The RSA 171A requires that the state create a comprehensive community-based service delivery system. So much of the funding within that contract is actually tied to individuals and families served. So just like when you asked Melissa and I if we could do with less agencies, the funding stays the same because there's Part C, which is early intervention. There's funding in there based on the number of children served.
Okay, fine answer. Shifting topics dramatically because I know you're a subject matter expert in this, is where are we at with going to the two-tiered standard billing for DD?
So I will say the suggestion that was made a few years ago from A&M about a two-tiered waiver system, that was something that we heard loud and clear from our stakeholders and families and people served, that was not something that we wanted to explore. So we took.
But it was a recommendation
It
from
was a
Alvarez and Marcel.
Correct.
And at one point, it was one of the recommendations you were going to implement.
Correct.
I didn't catch the subsequent rejection of that idea.
Yeah, I think about October in 23, we had a significant stakeholder engagement and really listened to the folks that we serve and decided that wasn't something that families thought would be beneficial. And we switched our focus to more rate-based work, which is where we focused the last couple of years on developing rates for services.
What is rate-based work? Talk about that a little bit.
sure.
And I'll tell you where I'm coming from.
Yeah.
I had a whistleblower call me last night. Never met the person before. Wanted to talk to me for over an hour. And this person was absolutely convinced that because all the area agencies set up the plans kind of differently and that they're individualized, that there's a tremendous potential, if not actual, waste in the millions of dollars. And so I don't know anything unless I confirm it with you all. So how do you respond to that sort of concern? And I sold it to him, or the individual, excuse me. I didn't want to give any clues away. So I sold it to the whistleblower that the A&M agreement or recommendation to go to a two-tier standard billing was the solution to the potential problem of disparity of plans and waste. And now I find out that I'm wrong.
So I think when we're talking about two-tier, we're talking about the waiver being in two tiers, not necessarily billing. So we had to do, as you know, the corrective action plan, which included changing the way that we bill. So allowing all providers who provide services to the DD waivers to be able to bill Medicaid directly instead of having the area agencies bill and then they pay that provider. So every provider has an opportunity to bill Medicaid directly and receive that full cost of service.
So I think I'm trying to talk about something different, and
Okay.
I'm just messing up the description, and so we're not connecting.
Can I
So-
interject?
Pardon me?
Can I interject?
Yes, ma'am.
I just to provide a little bit of clarity. Just because we had a contractor recommend something, we didn't
Right.
adopt that recommendation because we were listening to the folks that we serve who said
Right.
that wasn't going to help them. Part of what our charge was I think tied to what this person is asking about is in terms of what your needs are as an individual and how does your budget get developed for that. So in terms of needs-based care is like moving to our rate structure, which is where we have been moving, that we would do what we call SIS assessments, and that would be informed rate based on your care rather than how the state has historically done it, which is what I think this individual is talking to you about. We're like halfway through that work. We're not complete, and it doesn't look like we're going to be able to get complete in the next biennium, given that we don't have money to even look at those rates. So there is a movement to be able to better identify and be in tune with the need and the rate for the family and for the individual. So that work is underway.
Okay, and the reason I thought it was more than just a consultant recommendation is because I have a memory of HB2 where there were 3 bullets from A&M that we funded in HB2, and so I thought that was reflecting a commitment to execute those parts of that consulting agreement. But
No, I think the commitment is really to look at the infrastructure of how we do the work. And if it was two-tiered originally, that's not where we landed.
okay. And in this current budget, do you see any opportunity to save money by going to a more standardized rate structure or the work that you're doing?
In this budget, I don't think we'll see anything until the biennium after. I mean,
All
I
right.
think we could do the legwork, but I don't think the savings aren't going to come in 26 and 27.
All right, have to ask, right?
Sure.
So Representative Stringham?
Yeah, I seem to
then
remember
please.
the A&M study was about, still about 99% of the people would have ended up in the traditional waiver. There was a lot of concern about how quickly it was showing up. But I thought I remembered that you were also looking at a model from Maine, for potentially restructuring this ability in addition to, as all this information comes in, now that we're direct paying for a lot of these services, we'll have a lot more ability to model and potentially improve the effectiveness of the funds that we use for the disabled. And so I don't know if you have comments on either one of
I
those.
guess my biggest comment would be, we've been working with a vendor named A&M to help us. They don't drive the practice, we drive the practice, right? They do the legwork of what is out there for us to make decisions. We work with those we serve to make those decisions. So we've, adjusted along the way. I don't know about a main model, but I will tell you the model that we have had in the department is to pull in our stakeholders, whether they're providers or families, to say, help us figure this out. And that was, Melissa's referencing October of 23 is when I said we need to stop here and we need to sort of reset and re-engage and set that vision. And that's what we've been doing collectively together. So we haven't been doing anything to anyone. It's been trying to do it with them. I just want to make that clear.
Representative Priest?
Thank you, Mr. Chairman. As a point of clarification, you mentioned the amount of waste going on with these contracts.
The potential for waste, yes.
Okay, potential of waste. But have you seen any signs or evidence that this is occurring in these contracts? Because
Well-
if you have, I have not, and I would love to have that information.
Well, other than the whistleblower call that I got last night, I have not seen specific evidence, but I think anybody who looks at government long enough recognizes not that there's fraud, but there can be waste in terms of inefficient execution. That's very hard for us to get at. So
but
my
also-
hope is that by emphasizing it, it continues to socialize within the department the need to be good managers and shepherds.
I agree with all of that, but taking the whole testimony, an assumption from one person who we don't know, who we haven't seen anything from.
So are you having a problem just asking questions in public?
I'm
'Cause
just,
that's
a-
all,
I'm
that's
just
all we're
asking for
doing.
clarification.
We're asking questions in public.
I'm just asking for
We're
clarification.
making sure that there's no rumors or people sneaking around in the
Well, that's
background.
what I'm hearing, but
This is
I
why
just
I'm
want to have
saying it
clarification
in public.
because if this is
This is
real, then I would
this
like
is
to see it.
transparency.
I would like to see the
This is the
transparency.
sunlight.
Yes.
So you're interrupting the sunlight. We're just asking questions.
Thank you.
Representative Daniels.
Thank you. Pertaining to all contracts, are those with whom we contract allowed to subcontract to others?
Yes. So in the standard terms and condition language that the state has, it's the P37 form that I referred to earlier. Our contractors are allowed to subcontract only with written express permission of the state. And sometimes when we develop a contract, we specifically identify that further in the scope, but that is a standard state requirement.
And those subcontractors are obligated to the same obligations to which our contractors.
Yes, they carry forward the same requirements into those contracts,
Great, thank you.
and potentially more so if the specifics of the scope dictate so.
All right. So the other conversation that gets had is there's a concern about sole source. And what I know about sole source is from the federal contracting, where it was always the case that we were to go fair and open competition, and that when you did a sole source, you needed to have a specific explanation of why. And so there's this floating concern that the department is too quick to go to sole source. So how would you respond to a concern like that?
Well, I would first respond that any sole source in the department needs to be approved by me. So it's not easy for someone, program area or Melissa, to go rogue and say, I'm going to put a sole source. I'm just using her because she's there.
Right.
But
She's smiling. It's okay.
to put a sole source contract through. I know Nathan has a lot to say about this, but I just want to say that I'm very clear with staff what the expectations are about competitive procurements, and they don't apply in every single case. But where they do apply, it's the expectation that things are going out to bid or RFQ or whatever the acronym is that we're going to use to say what is the audience out there that could potentially meet this service or provide this, deliver this service or provide this good. So that is always the first and foremost lens. We have specific services that there's not a plethora of providers. Sometimes there's one. I'm lucky if there's one in state. Sometimes I've got to go out of state, which causes a whole nother line of attention of why aren't we using someone in state? Well, because they don't exist. So I just want to set it straight for the record that I think my staff get nervous when it becomes sole source because they understand there's going to be a big line of justification to get past me before even getting to council.
Right. So if I could summarize that and put it away, I think what I'm hearing is that, yes, you have to use sole source contracts from time to time, that you have a meticulous process to make sure that they're valid, and that any kind of contract that you have gotten under sole source, if somebody looked at it, the explanation and rationale and the support for that decision is there.
Correct. There's no way I'm going to defend a sole source contract without I have to have what I need to defend
Right.
it.
Okay. Thank you for clarifying that. We have a draft on an HB2 item, and what this HB2 item is trying to do, and this is no surprise to you because we've been talking about DEI for a couple months now, but we're trying to make sure that in the contracts that we're also holding our vendors accountable for making sure that they attest or remove any DEI programs. So that's kind of the main point of this. But I think the other day I had one of your staff members say to me correctly, well, what is DEI? I said, I don't know. It's just a bunch of letters and people can change the name later. It was offered to me that I would get some more language that would be more definitive. So I just would like to ask that if, I think the person may actually be in the crowd, but if I could get that better language, that would be good, because we have a draft of it and we just need to clean it up a little bit with the definition.
We will get
Okay.
that to you.
Representative Nalvanko.
Yeah, Nalavanko, thank you. Mr.
Nalvanko.
Chairman.
I'm getting closer.
Yeah,
I've got the L in there now.
You're much better than most in-laws.
Yeah.
Thank you. A question back to sole source for a minute. Of the 969, I guess, contracts
I think
that you show in the, I guess, on page 2, approximately
Could you get the mic closer to your mouth?
Oh, sorry.
Thank you.
of the 969 contracts that you show on page 2, what ballpark, what would you estimate the percentage of sole source contracts would be if if we're able to dig into that and look at them all?
So it's really hard to pull out a percentage right this second. Nathan can get you one, but I will say it's that moves in time as well, because sometimes we go to renew a contract, we know we're going to reprocure it. We don't want to have a gap in the service, so we may do a sole source extension until that can be bid. So that number is going to be constantly moving about. Percentage of what's sole source, but Nathan, out of that 969, will follow up with you with a number of approximate. It's approximate for sole source.
And if I may, a follow-up question. I've tried to look at a lot of the contract, and it's obviously very early on in the discussions that I think we had in this committee. Basically, the answer was pretty hard to pull out a lot of this stuff, and I can attest to that. It's tough to tie these back to specific line items and budget items. And I guess on the sole source, what I noticed on a couple that I did look at, that they had renewed across bienniums, and obviously for reasons, and the amount of the initial contract, if I understood what I was looking at, was X, and then it was significantly larger in subsequent renewals and still showed as a sole source. Is that Does that occur? Again, I've only been able to do a small sampling and trying to pull out some of these contracts and looking at them.
Sure. So there's specific rules in New Hampshire around sole source, and these are dictated within the Manual of Procedures. It's MOP 150, as it's often referred to, or the DAS Handbook for Administrative Procedures. And if a contract is initially a sole source, any subsequent amendment, no matter how small, whether it's a renewal, whether it's the addition or a correction to scope, whether it's a minor adjustment, that will forever be called a sole source. Additionally, if we have a contract that we go out to bid for, there's 15 bidders, they win, and we then add more than 10% of funding outside of the original scope, that then becomes a sole source as well. Or if we did not have sufficient renewals, but for some reason, specified in the contract, but for some reason something happened and we were unable to rebid that in time before that service expired, that would then become a sole source request. So when you look at the sole source items on a GNC agenda, you have to pay very close attention to the description in the letter that details a specific reason for why it's sole source. Because the traditional thinking is, oh, sole source is going to go out to bid. But the rules that the state have do not apply that traditional thinking. They expand on that significantly.
So just a quick follow-up.
Keep going.
Yep. So what you're telling me is there's a definitional issue on sole source, if I understood what you were saying. So when you go back to look at what percentage of the total 969 contracts are sole source, it would include in that a whole grab bag of contracts.
We can control for that.
Okay.
Yep.
All right. Thank you.
Okay, so back to the general questions. There's some work that's been done at the finance level, looking at the entire state, taking a look at personnel. And one of the observations is that in some departments, I'm not even talking about DHHS, I'm saying statewide, there are some departments where an individual is in a supervisor position with no one or just one person to supervise. And so the thought is that we may have lost some discipline in the human resources area. As I'm thinking about contracts, I'm wondering if it's the case that the department has a supervisor with few people being supervised, if they're also being held responsible for executing a contract. Because in the military, we used to call these contracting officer representatives. It was sort of like the person who maintained contact with the vendor and the deliverables, and it was almost like a full-time supervisory job. And so I'm just curious, how you assign individuals to manage and oversee contract performance, and if when they do that, if they get credit for supervision.
I thought you were going to ask me about the contracting unit, designing the contracts versus the oversight of them.
Well, I think once the contract gets designed and signed, somebody still needs to manage it for performance, I imagine.
I totally agree, but just if I may have a moment with 969 contracts, we have a well-oiled machine for a contracting unit, and I just have a moment here just to brag about that,
Right.
because how you design in the beginning plays into how it gets monitored and tracked afterwards, right? It's a big piece of that. So we have spent a long time, and I'm very proud of the work that we do and how we have contract specialists working with our program areas who eventually are going to take the product of the contract and be responsible for monitoring that service and those outcomes. So I think we've got it right on the front end. I think when it comes to the contract monitoring, you're not going to like this response, but I mean, my staff can only be stretched so many different ways,
Right,
right? I mean,
right.
I've got one FTE to do a set of responsibilities, and oh, by the way, I need you to be monitoring this contract, and this contract. So
Right.
through the work
You got
of
969 contracts. I don't know if you got 969 people available to do this.
And I'm not convinced it's a one-to-one necessarily,
Right.
but the point being is that with Meredith Telus, who you've heard from quite a bit, and leadership really looking at how are we making sure we have that engagement from monitoring and course correcting as we go, so we don't get to the end and say, oops, that's not what we wanted. So those are ongoing efforts. It's not as a well-oiled machine as the thing that sausage making machine that puts the contracts together. The other part of it is still in process, but resources are an issue to be able to do that well. We do it. If you look at the contracts on this page here, these are what we would call our higher risk contracts, right?
Yeah.
They're the higher dollar amounts. So these do have much more attention and folks overseeing them than maybe some of the smaller contracts. 969, you're looking at 18, possibly 20 out of the 969. We have ones that are smaller that don't require as much. So
Yeah.
I don't know if that.
I was trying to get to a very specific thing in a human resources environment. If somebody, a state employee, is accountable for managing the execution of a contract, does that improve or increase the justification for them having a supervisory position? It's just HR mechanics is what I'm asking.
Yeah, I'm not sure that we have folks that are monitoring. I would have to look at who's responsible for contracts and what their title is. I mean, if they're monitoring a contract, that's not the only thing that they're doing.
Right, right. Okay, Representative Seaworth, you've looked at contracts a lot. I want to make sure that you have an opportunity to ask any questions you may have. Do you? Not at this moment. All right, Representative Daniels, and then we'll go to Representative Mooney.
Thank you. Over the past week, I heard an advertisement that was on behalf of DHHS looking to increase the size of a particular program, which kind of makes me wonder, how are you determining the success of a contract? You looking at it in terms of we're getting more people, or is it that we've been able to get people off of the program? How is it that you're determining success of those contracts? Because I've also talked to a previous DHHS commissioner who acknowledged that there were organizations out there that really weren't living up to their expectations, yet we were continuing to give them money.
I'm not sure what program you're referencing when you heard an advertisement for an expansion. That might help. I think in terms of each measurement piece is different, right? It's really based on needs, not so much wants. So if there's a particular increase in need in any one of our populations, and we need to meet that need, then we're going to need to adjust the contract that provides the services to that. The last thing I would want as commissioner is to be giving money to an organization that isn't meeting the needs of those that we serve. I mean, that's the work. That's part of our work that we do to monitor that. And when contracts are up for renewal, we look at the return on the investment. We look at the money. We look at the people served and did it meet it or not. We've terminated contracts. I mean, in the last year alone, we've terminated a handful of contracts where the vendors were not meeting the expectations. So I can only speak from what I know of my experience today and what I've done in the department last 28 years, the last 2.5 years as commissioner. We don't give money to people that aren't performing. And if we find out that they aren't performing, there's course correction to help them perform or to move on.
Yet I have heard it, and I've heard it locally, promoted by my school board, that we need to find more and more people to get the free and reduced lunch.
I'm not, can you,
Well, I mean, there may be a need where if people know about it, they can come in, but to go out and try to recruit people in to get a free and reduced lunch is just going to cost more. It just seems to be the inverse of what the department should be doing, which is trying to help people become self-sufficient.
well, the department is also helping people that currently aren't self-sufficient and are in need of food.
But do you need to recruit them?
I'm not aware that I'm recruiting them.
Okay.
So I was going to go to Representative Mooney, but I think your point is related.
Thank you. Having worked on hunger issues with children, I would just respond to Representative Daniels by saying they're not recruiting and looking for people to grow their program. They're looking to identify those children who already qualify and are going hungry because the parents have not yet been able to fill out the eligibility for free and reduced lunch. It has nothing to do with growing a program. It's identifying the children that qualify. Thank you for giving me that time.
Sure. And thank you for not making it, and thank you for presenting it factually based on your observation. These things can descend into argumentation. I'm really happy that we avoided that. Thank you.
Well, I worked really hard on that bill this year, so I feel like I can
Yes, ma'am.
share my expertise on it. Thank you.
You are a subject matter expert. I acknowledge that. So Representative Mooney?
Thank you, Mr. Chairman. Thank you both for being here, and thank you for this presentation. This was sort of a last moment addition to our scheduled presentations, and yet still you can put together a very thorough 40-plus page coloring book. So thank you both. When I think of contracts, I think of Law School 101. You have an offer, acceptance, consideration, then there's a whole host of defenses to try to get out of it. Illegality, accord and satisfaction, duress, statute of limitations, it goes on and on. Here, though, a contract is so complex. You've got funding issues with the House and the Senate. You've got to go through the Executive Council and so forth. Do you have boilerplate language in your contracts that says subject to funding? Because this really isn't about two parties getting together with the basic elements of contract. There are far more dimensions to this spectrum. And I'm wondering, if our role evolves into something, is that going to be prevented because there's an agreement with funding and so forth? Your thoughts. Thank you.
Sure. So, slide 5 provides a little bit of a 40 or maybe even 60,000 foot view of the process that Representative Mooney was referring to. But in the standard terms and conditions, both in the standard contracts as well as the grant agreements, there is a provision in there, and every GNC request that we submit down there as well includes subject to available funding and appropriations. And that is a standard terms and condition clause that does exist. What we do from a general operating perspective is we do submit our budget, and then come May or June, we do submit those contracts that we plan on renewing forward to GNC, and there does exist that standard term and condition, because if we were to wait for hundreds of contracts until July after a budget passed, we would obviously have some challenges there. But that's been the general operating principle. And at the guidance of the Attorney General, they ensure that those provisions are always included in our contract.
Nell Vankel, closer.
Getting better. Thank you very much, Mr. Chairman. I want to build on, I guess, both Representative Daniels and Representative Talerski's comments and the question. I apologize for not having the hard copy, but when I was doing the sampling of trying to dig into contract language, I believe I had one that had in it kind of an incentive clause, which I'll call that an incentive clause, that said something to the effect that the contractor was responsible for increasing the clients by 25% a year. I will find that again. And I'm wondering, do we have any contracts that have what I would call incentive clauses that maybe drive costs in the wrong kind of a way? And I will say that, I am definitely a proponent of providing for people that need the help, also for making sure that they're aware of how they can get the help. But I'm disinclined to, again, if I understood Representative Daniels' question, I'm disinclined to beat the bushes to increase the numbers.
So I would say that the work of the department is to serve the folks in our state that need help, right? So that need doesn't go away. And we know that the more people that we give help to, the more people that can get preventative care, the more people that we want to incentivize moms to get prenatal care, because we know in the long term it's going to make for good families, it's going to make for good children, it's going to make for folks not needing to continuously rely on our systems and increase our costs down the road. So when we're looking at incentivizing, it's about keeping people healthy and safe and not looking towards that longer, higher term cost. So the department's different. We're not in the business of a typical, to your point, I mean, it's complex, it's different. Our incentives, some of them are driven by federal requirements, some of them are driven by state requirements, some of them are driven by litigation. So when we get more uptake, it isn't to spend more money, it's really about the health of a population and in the long run, saving money.
If I may, sure. And I'll give it's a relatively dated anecdote, but a personal anecdote. I've 5 children, all of them grown now. We were living in Fairfield County, Connecticut, and my wife had 3. We had 3 kids under the age of 5. She was in a grocery store, and she had a pretty well-dressed woman come over to her and say, "Are you signed up for the WIC program?" WIC still exists, whether the story is still relevant. And my wife said, look, my husband has a good job. We're frugal in how we're okay. We don't need to have take advantage of that program. Somebody else should. And the woman said to her, straight up, she said, no, that's not the point. We need to increase our numbers. And that's relevant to my question about where incentives are. And that's different from providing needs. It's basically a cost driver that shouldn't be there.
If I may respond, the department isn't interested in having cost drivers. We're interested in a healthy population that gets services when they need it, and that they're not contributing to longer term costs down the road. I mean, we talk about kids that need food. If kids don't get fed, what happens then? I mean, that's consequential, right? So it's about getting it at prevention. We don't do what we do to drive up costs. If anything, it's for the health of those that we serve and to bring down the longer term costs. And I'm just going to say that. Now, that isn't to say this is what the department does. People are going to disagree with it. People are going to have their perspective of what we're actually doing. But I'm sitting here in front of you as commissioner today to telling you that our priority is the population in the state and the people that we serve. And that is what our premise is of all the work that we do. We're not looking to spend money where we don't need to spend money. We're spending money on people's lives for population health, not so they have nicer clothes or they have better food.
Thank you for that, and I think I'm in agreement with the basic principle.
Representative Priest,
Thank you, Mr. Chairman.
you turned your mic off.
Okay, thank you. In my previous life, I was a private contractor with the planning agencies, and we did a lot of contracts with government agencies in New York and Washington, D.C. and L.A. And so I've kind of been around this area a lot. And in order to have a program be successful, there's always a stage or a part which you need to engage in the public to get the word out. And it was never an incentive. It was, if you want the program to be successful, you have to go out and do an outreach to that. And I'm seeing this is very similar to what you are doing with your programs at DHHS. Is that correct? Is that a fair assessment?
So if you're talking about that we know that there's people that are in need and don't know there's resources, yes, we want to make sure that people know the resources are out there for them.
Thank you.
Okay, I think we're getting close to wrapping this up. Is there anyone in the audience that wanted to speak today? Because as long as we've opened up the door to personal stories, I've got a personal story to tell. Do you have a question?
A different kind of a question. A lot of the contracts that we have, some of them continuing into this, into the next biennium, were heavily influenced by COVID. And I'm wondering if there's any language that persists in there that now that the pandemic is over, whether there are provisions, for example, programs to communicate with regard to misinformation on vaccines as a throw-out example, and other things that were COVID related that still exist in the contract language on some of the carryover contracts.
It's red, but I don't hear you. No, try. No. We must have used our last quarter. Do you want to move to the other?
Oh, there we go.
There it goes.
All right, we're back on. I'm not aware of anything, as I think most of those contracts would have expired years ago. And I mean, during 2020, 2021, we had a lot of one-time impromptu contracts. Some of those continued into 22, 23. But I think by this point in time, I think most of those pandemic era contracts would have expired. I mean, we have a couple of remaining ARPA projects, but those aren't directly related to what you're referring to. So I wouldn't expect that.
Okay, thank you.
All right. Again, I think I'm wrapping up. I didn't see any hands in the audience to want to speak today, so I'm going to assume not. And so this is my closing story. When I was a kid, there were two shows that dealt with boats that I liked a lot. One was The Love Boat, and then the other was The Titanic. And in the Love Boat, everyone was happy. It was easy to be Captain Stubing because everybody was happy. And then you go over to the Titanic, and that captain, he had different problems. He had a different situation. And I just drew the conclusion that it's better to be the captain of the Love Boat than of the Titanic. And this budget is not feeling like the Love Boat. This is going to be a tough budget. And in my experience, nothing creates tension and conflict as quickly as scarcity. When you have scarcity, you start to really energize the animal spirits of people who care about things passionately. And I think in that social dynamic, that's probably what's motivating some of these calls and concerns that I'm hearing. And I think that the best way to deal with these kinds of whisper campaigns is to get the whisper out into the open and deal with it publicly. And I know you, Madam Commissioner, I know your staff really well. You're all very professional and you can handle tough questions. And so I would rather just deal with the tough questions in public than to have a whisper campaign undermine anyone's credibility or belief in the process. So I appreciate you coming in and addressing contract issues. This is the third budget I've been involved with. We've never had a contract day. And I don't know what we've learned from this, whether we're going to do it next budget cycle, whoever's here. But so this was a little unorthodox because it was the first time we've tried this, I think. So again, I would rather have us have the open dialogue than to have people think they can be effective by going around undermining others. So thank you for your transparency and your willingness to come in today.
Thank you for not asking me which boat I would prefer to be the captain of.
Well, the Poseidon adventure wasn't any good either. I'd avoid that one. But all right. I see no other questions. Mr. Ripple, what do you got for us before we close out?
Nothing else at the moment.
Okay. When are we going to meet again? Am I recessing till Friday?
I had suggested that you recess rather than come in tomorrow. It's up to you whether you want to come back in on Friday to have the department discuss some follow-up information, the change requests that they've submitted and will continue to submit, and some other stray items, or if you want to just wait until Monday morning's meeting.
We're running out of time. If we need feedback and input, particularly if it should be in the open and public, we better do it no later than Friday, right?
Okay, sure. Then Friday sounds
Okay,
good.
so I'll go ahead and recess to Friday. What time is that on the calendar?
Friday hasn't been calendared
Oh,
yet,
okay.
but so you can recess until whatever time you'd like to meet.
Well, the only thing on the calendar is tomorrow, isn't it? Yes?
Tomorrow at 10.
Okay, so at this point, I think what I need to do is to recess to 10 o'clock tomorrow because we have to stay with the calendar. Or
you
can
could-
we still add something to Friday?
You could just recess Division 3 until Friday morning, and we'll. I think that
ahead.
that would work.
Go ahead, Representative Money.
It's my understanding fiscal committee meets this Friday at 10. Is that a true statement?
I thought that was.
I thought I did see a pre-fiscal. I didn't see a
subsequent Friday.
fiscal.
Oh, it looks like 11 on Friday morning.
Let me just check that.
So I'm preparing to, so you
So-
guys can think about, oh, go ahead.
Okay, I'm sorry, you're right. It does meet. Fiscal does meet on March 21st, so maybe you could meet Friday afternoon
Right.
Instead.
All right, so I'm going to recess us till Friday at 1 o'clock. And the subject is rather TBD. It's to clean up any last minute requests for information that are critical to our budget process. And how will we communicate that so that the department knows what we're doing? Do we have a punch list of critical issues?
I can discuss it with them, and we can we can come up with a list.
All right. So at this point, we're recessed till Friday at 1 p.m.